So good morning, everyone, to all of those who have already joined. Nice to have you here. We are still waiting a few more seconds until other participants also joined and start in a few seconds. But welcome, a very warm welcome to today's demo day. So we have a message in the chat. Gabriele, can you quickly send the message, the invitation link to? Perfect. Thanks. Great. So I think more and more people are joining today's session, so we can already start, that we are not losing more time, and to give the demonstrators enough time to showcase their solutions. So first of all, again, welcome to today's demo day, Secure, Data-Driven and Citizen-Centric Digital Health Solutions. My name is Leonie Fahd. I'm a project manager at Steinbeis Europazentrum in Germany, part of the coordination team and work package leader in the ShiftHub project. Today's event is co-organized together with the University Hospital Cologne and BIK. My ShiftHub colleague Adamantias Kumpis from the University Hospital Cologne will moderate today's session, and it's a pleasure to have you all here with us as we explore practical solutions that address key challenges in digital health, including cybersecurity and network protection, real-time prediction for respiratory diseases, and health data visualization based on real-world data. So I'm very curious to get more details on the demonstrations. And demo days like today's are a key part of the innovation journey. With them, innovators are given the opportunity to showcase their solutions to a wider audience, gain visibility, and connect with potential users, partners, and investors. And in this regard, today, you will discover 3 pioneering innovations that accelerate cybersecurity and network protection, support the monitoring and management of respiratory diseases, and focus on health data visualization. Each presentation will offer an in-depth look at the tools, so please feel free to actively engage by asking questions, sharing your thoughts in the chat, and connecting with the presenters. And also in regard to the demonstrators, we are very happy to have you here and looking much forward to get more details on your demos. And before we dive directly into the demos, I'd like to briefly introduce the ShiftHub project. So in ShiftHub, our aim over the last 3 years was to foster the development and uptake of smart health technologies. So basically bringing smart health innovations to the people. Our project was a coordination support action funded by the European Commission, and it ended in December 2025 after a duration of 3 years. And the consortium consisted of 12 partners that represent important stakeholders and expertise within the smart health ecosystems. So this includes our 3 universities as knowledge providers, 4 organizations as innovation intermediaries with experience on how to support and connect diverse stakeholders, then 3 technology providers providing different tools to our services, and 2 partners specialized in engaging our target groups, including small and medium-sized enterprises, technology providers, as well as patients. And together, our main goal was to facilitate the development, ensure the promotion, and foster the uptake of smart health technologies and services. And to reach that goal, we established our hub to provide services to all stakeholders of the smart health innovation ecosystem. And we developed a service offer which is centered around 3 pillars. Those 3 pillars represent the 3 key values that were designed to meet the needs of our stakeholders. So these are either to build and boost your innovation, to connect and thrive collaborations, and to learn and grow your knowledge. So whatever the value is you're looking for, you can find the respective services listed, for example, on our website. Even though our project has ended already in December, almost all of these services maintain somehow. They will either be continued by the respective partners, or we have established replication opportunities to adapt adopt the methodologies, for example. Some of these replication opportunities are formulated either in our comprehensive best practice guide or summarized for each method in the best practice sheets, which you can find on our project website in the resource section. So if you are interested in, I invite you to dive deeper into the documents. And before I close my introduction to ShiftHub, I'd like to point out another key legacy, which also will be sustained after the project, and this is our ShiftHub community. With the registration to today's event, you have already joined the ShiftHub community, and this community platform is a dynamic online space with the aim to connect stakeholders across the European health ecosystem to foster collaboration and accelerate the adoption of smart health technologies and services. Currently, the community connects more than 800 international members, providing them, amongst others, a marketplace to showcase their solutions and to find partnerships. Additionally, via the platform, you gain access to many events such as our brokerage events, B2B matchmakings, the focus groups, diverse workshops, and other networking opportunities. So, as already said, the community will stay active and will be maintained by our partner, the European Digital SME Alliance. And the consortium, of course, and also partner organizations will continue to use the platform to host events in the future, such as other demo days, focus group events, or webinars. So this still will be an active environment for you to use also. And I'd like to especially point out the marketplace. Here you can showcase your offers, which can be products, services, expertise, partnerships, but also investment opportunities or project corporations. So you also have the chance here to browse the offers of other community members, as well as to reach out to any member by direct messaging. This way you can connect with potential business partners or find collaborations for future innovations. So if that is of interest to you, I encourage you to also explore and showcase your solutions there as well. And other than that, that was a very brief introduction into the project. And with that, I would like to hand over back to Adamantios. Thank you.
Thanks, Leonie. So we can now start with our demonstrations. The idea of demo days are that they are focused on having people who develop something, a technology, a product, or a solution, to actively share it with others and create some impact in terms of follow-up collaboration that can be established either as part of research projects, innovation actions, or research collaborations, but also as part of potentially commercial actions that might be related with fundraising from private investors or other institutional investors. The first one to present is Pavel Piskac from Whalebone. Whalebone is a startup, an SME in Czech Republic, and what they will be presenting is the Whalebone Immunity Suite, so that users can take full control of their DNS traffic and secure their network's blind spots. So, Pavel, the floor is yours. You can also share your screen, and we will be eager to listen to your presentation. And also, we can all ask questions and add them in the chat, and then Pavel will go through them and answer them. Please, Pavel.
Thank you, Adamantios, for our introduction. So once again, my name is Pavel Piskac, and I'm a technical consultant at Whalebone, which is a Czech-based company. We are located in Brno, and we specialize ourselves in DNS-based security. The advantage of that is that unlike traditional antivirus software, which requires installation, we do not require any installation on end-user devices, which means that we can protect even specialized devices such as X-rays or IoT devices or smart TVs and so on. So we can protect all types of devices because we protect the DNS protocol, which doesn't require any installation on end-user devices. And our main focus is on in the telco market, where We cooperate with various telecommunication companies, and their user base is approximately 1.6 billion users. So this is our main product for telco operators, but we also have a product for ISPs, internet service providers, and businesses. And today we would like to present you and demonstrate our product called Whalebone Immunity, which is for businesses. In a nutshell, what we do, you have an overview. So we work as a DNS forwarder. So it means that we receive DNS requests that are coming from end user devices, and we have a huge threat intelligence database, which has plus minus 60 million records, and we evaluate if the target domain is safe or not. If it is safe, then we will forward the request to the authority DNS server, and the user will be able to access the domain. On the other hand, if we know that the target domain is malicious, then we do not forward the request, but we redirect the user to a blocking page where we inform the user about what happened and that the target domain is malicious so that the user cannot access it. And I think that it's enough about the theory, and it's time to show you something more practical. So let's start with an example of an unexperienced user who received a phishing email. And this is the phishing email. It informs the user that something malicious or suspicious happened with the user's account and that the user should review and secure the account. There is a button in the phishing email, and the user is unaware, so she clicks the link and she becomes a victim of a phishing attack. And this is when we can step in and when we can protect the user. Whalebone supports two types of resolvers. The first one is our on-premises resolvers, which are installed in the customer's network. And then we also support cloud resolvers for those customers who do not want to have any on-premises infrastructure. I would like to show you how easy it is to install a new on-premises resolver, because usually installing something on premises, it's a big hassle because there are lots of requirements, complicated installation. But in our case, as you can see, it's fairly simple. Just a few clicks, the web generates a command, and the installation is running. The installation takes approximately 1 minute, maybe 2, and then the initialization of the threat intelligence database takes approximately 2 or 3 minutes. So in the meantime, since we have some time, I will tell you more about the product. So what you can see is the admin interface, where you can configure the whole solution and where you have an overview of all the DNS traffic. This web interface, admin interface, is in the cloud. So we support two types of installations. The first one is hybrid, with on-premises resolvers in the customer's network, and the management and the backend in the cloud. And the second installation method is with everything in the cloud and managed by us. And now I would like to show you how easy it is to configure the solution. So you can define multiple security policies and then assign the policies to individual subnets to protect users. For example, you would like to protect, you would like to have different security policy for visitors, then different security policy for employees. Each security policy allows you to set its sensitivity, because all the domains we have in the threat intelligence database have a score, and the higher the score is, the higher risk the domain represents. So if you would like to have more relaxed blocking, then you will make the number higher. If you would like to have more strict blocking, you will lower the numbers. And that's not all, because we allow you to define your own custom allow list, where you can define those domains which will always be allowed. They will never be blocked. Similarly to this, denial lists with those domains that will always be blocked. Then we support regulatory restrictions, because some countries have mandatory or some laws that certain domains must always be blocked. So currently you see that there is a regulatory list for the European Union. And finally, we have content filtering, because we also have a database with domains and the content which is there on those domains. So we can block various types of contents. You can configure all this, and I would like to emphasize this social network category, which is marked to be blocked, because we will use that later. Okay, so let's see what happened here. So the resolver has been installed, and now let's check the resolver itself on the web. So as you can see, it's still being installed. So in the meantime, I will, just a second. I have a command here to check if the threat intelligence database has been initialized. Not yet. So this is quite cryptic, but it's for me to know whether the resolver is ready. So we need to wait a bit more, and I would like to use this opportunity to reconfigure the resolver, because there is one mandatory change that not mandatory, optional, but still I would like to do it. And I will explain why. So the blocking page. So I informed you about the blocking page, and which informs the user about what happened and why the user couldn't access certain domain. The blocking page can be hosted in the cloud or on the resolver. I will choose the blocking on the resolver because it allows me to use a custom certificate, which is installed in the demo virtual machine. And it also means that I will not see security warnings that the target domain has unverified security certificate. So the web interface informed me that the installation has finished, and something failed, but let's ignore it for now. And for that, I will need to enter the IP address of the resolver, which I have here. And the IPv6 address, which I don't use. So I did the configuration. Now I will push the configuration to the resolver. So it's upgrading. So it's pushing the new configuration to the resolver. And in the meantime, I can show you the blocking pages. So here are the blocking pages. As you can see, you can define multiple languages. And there are also various blocking pages for various situations. So security, it means when something is, this is shown for malicious domains. Blacklist, this is for those denial lists, and so on. and you have full control over the blocking page. So this is the default look, but you can always edit it. You can change the colors, you can change the logo, you can change everything on the page so that it matches your company branding. So the change has been applied. So I will validate if the threat intelligence database has been applied. It has. So let's do the demo scenario again. So we have Eleonora, we have again the phishing email. Eleonora is still unaware of the malicious activity. So she clicks the link again. Oops, this is the demo effect. So sometimes, oh yes, my bad. I'm sorry, this is not the demo effect, this is my bad, because I forgot to reconfigure the workstation, because previously it was using Google as the DNS server, but I installed the new resolver, so I had to reconfigure the workstation to use the new resolver. Usually this is done by administrators on the DHCP level, so they will reconfigure the DNS server in DHCP, and the address will be distributed automatically to all devices so that users do not need to do anything. Okay, let's try it again, and I hope that the domain hasn't been cached, because if it has, then it will not show me. Oh yes, it's in the cache. So I will reopen the web browser, which clears the cache, and it will not show me. It will not show me the phishing site. So this is where we have the email, and so this is the perfect example of a demo effect. Everything was working fine when I was testing it. Testing it. Sorry.
Which let me only intervene there, Pavel. This is something we experienced also in the past, and for me, this is very normal, very natural, and I have no problem at all. In contrast to the idea that people always prefer to present slides and not show anything. So for me, it's very normal for all of us who have been involved in technology development and in research. This is very normal, and I wouldn't say welcome, but it's very normal. And this should not be any reason at all why people should stick to only presenting slides and nothing that is live. Yeah. So feel comfortable, Pavel. Yeah.
It's definitely not comfortable, but oh yes. So never mind. I'm sorry for that. You will not see that Eleonora cannot access the page, because for some reason something is broken, and I don't want to waste your time by investigating what went wrong. But in the meantime, or instead of that, I will switch to the last part, which is the DNS traffic overview. Because in many cases, customers or organizations, they don't know about DNS traffic. They don't know what's happening on the DNS layer. But it's important to know that, because 90% of all attacks use the DNS protocol. And if there is something, a solution which can work with the DNS protocol and which can block malicious domains, then you are automatically protected against 90% of all attacks. So this is something what we can do. We can give you the overview of what's happening the DNS layer. And we can show that in 3 different overviews. The one which you can see on the screen is DNS traffic. So this is all the DNS traffic which has been recorded. And in this case, you can see all the domains and how they have been resolved. It supports filtering. There is so filtering. So you can investigate. For example, if you know that certain workstation is doing something malicious, you can filter all DNS requests coming from that workstation, and you can observe some patterns and investigate what's going on there. Then there is the threads overview, where you can see all blocked threads or all blocked domains. And again, it supports filtering, so you can filter all DNS requests from certain IP address, or you can filter. For example, if you know that there has been an attack, you can click into the chart. It's fully interactive, and you can see which clients were talking to the malicious domain. So you know that these workstations are probably infected, or they did something malicious. So you can use other tools to investigate what's in the operating system, if there are some viruses and so on. And you have the same overview also with the content, so you can see which clients try to access domains with blocked content. And it's up to you how you decide to work with this data. And finally, if you would like to protect even those users who are working from home or who are on business trips, we have an application. It's called Home Office Security, and this application can protect workstations and smartphones even when the users are not in the company network. But in this case, certain installation is required because, as I said, it's an application called Home Office Security. But this application allows you to protect users wherever they are. And with that, I would like to stop talking, and I would like to ask you if you have any questions.
Pavel, quick question from me. Is Eleonora safe now to click on malicious link?
Yes, she's safe because she cannot access anything on the internet.
Yeah, that's the most important thing.
But yes, if it was working correctly, Eleonora wouldn't be able to access the domain. But I'm sorry for that. The demo effect is secured. Something went wrong, and I was cut from the internet.
No problem.
Yeah, actually, I think that, okay, this might not be very proper what I'm going to say, but it is bloody true that in organizations like the University Hospital of Cologne that I'm working for, there are, of course, departments that are supposed to be taking care also of these aspects that you have demonstrated before, Pavel, but they are usually overloaded with many other tasks. So the degree of proactiveness is rather low. And of course, there are also seminars, awareness activities. But at some point, what I see is that it's not bad at all if especially public organizations are more positive about acquiring products that might also reduce risks. But usually, even if an organization may be a victim of cyber attacks, the learning curve is not steep at all. So usually it might only be in a far future that they might take measures. And this is also, I think, the same also for many private organizations that are rather small, because private organizations that are big are much more eager to protect their assets. And so I see that there are no questions, but people can also watch the videos also on YouTube, and later we have them in the platform, and they can always come back to you. So thank you very much. Thank you, Emil, and thank you, Pavel, very much. And now we go to the second presentation from Respibit, Bulgaria. And it is Alek Alexopoulos and Christodoulos Pagakas. And what they will present is AsthmaFit, which is a fast and reliable real-time prediction for safe and active living with asthma. So I would like to consider AsthmaFit as some type of medical device, but it's up to you, Christodoulos, how you will present it and how you will be defining it.
Okay.
So, thank you.
Thank
The
you,
floor is
Adamadios.
yours.
Thank you. Let me share my screen. Okay, just a moment, please. Okay. Thank you, Adamadios. Good morning, everyone. Thanks for the invitation. My name is Christodoulos, and I'm thrilled to introduce you to AsthmaFit by Respibit, an innovative solution that's transforming how people with respiratory diseases live their daily lives. Today, I will show you how we are turning reactive asthma management into proactive, personalized care through cutting-edge wearable technology and artificial intelligence. Let me start with an overview of what AsthmaFit is. AsthmaFit is a comprehensive respiratory health management system that combines wearable environmental sensors with intelligence predictive analytics to help asthma patients manage their symptoms proactively. Our technology is protected by US patent on August 20th, 2024. This patent covers our unique approach to real-time environmental monitoring, symptom and exposure tracking, and personalized risk prediction. The core focus of AsthmaFit is symptoms and exposure, not just symptoms, and not just tracking them after they occur, but predicting and preventing them. The problem. To understand the problem we are solving, I want you to meet Anna. Anna is an executive living in Thessaloniki, Greece. Every morning, she enjoys her coffee while planning her day. But Anna lives with a constant challenge. She has asthma. For Anna and for over 300 million people worldwide with asthma, every day brings uncertainty and fear. Will today's air quality trigger an attack? It is safe to exercise outdoors. Should she take preventive medication? Will she need to cancel important appointments because of breathing difficulties? The current approach is reactive. Patients like Anna wait until they experience symptoms and then reach for the inhaler. There is no early warning system, no predictive capability, and no way to plan activities. This reactive approach leads to unexpected asthma attacks and emergency hospital visits, missed work, cancelled social activities, and reduced productivity. Also, constant anxiety about what might trigger the next asthma attack, and higher healthcare costs and reduced quality of life. Of course, Anna deserves better. Millions of people deserve better. The fundamental question is, how can we help Anna take control of her respiratory health? This is exactly what AsthmaFit does. Let me show you how AsthmaFit works. AsthmaFit creates continuous personalized respiratory health management. 4 steps. The first step is the wearable device. Our compact wearable device continuously monitors the air, detecting the pollutants and conditions that could trigger asthma in real time. Think of it as having a personal air quality lab that goes everywhere with you. The step 2 is intended activity and symptom entry. Through the mobile app, Anna participates in health management. She can log intended activities. For example, I plan to jog at 6 o'clock, or I have a downtown meeting at noon. And of course, record symptoms and exposure as they occur. This two-way communication is crucial. AsthmaFit is not a passive monitoring. It is an active partnership between the patient and our intelligence system. The step 3 is real-time updates. As environmental conditions change throughout the day, the system provides immediate updates directly to Anna's wearable device and mobile app. If Anna is about to leave for her jog and PM spike to the traffic, she gets a notification. The last step is the daily risk analysis. This is our patented AI algorithm, and every day our system analyzes real-time and forecasted environmental data from the wearable, Anna's planned activities for the day, her personal symptom and exposure history, and weather and air quality predictions. The result, of course, is a personalized daily risk analysis for Anna. Instead of reacting to symptoms, Anna can now prevent them. She is empowered to plan her day with confidence, knowing exactly when it's safe to be active and when to take precautions. The wearable device, let me show you in the camera, the wearable device. We have multiple versions, for example, without display. I think you can see from the camera. And
yes, we can see, yeah.
Okay, and one with display. This is with display with the measurements of environmental sensors. Okay, this has a display. What makes our device unique? Our device is about multi-sensor technology. It has one PM sensor that measures particulate matter from PM1 up to PM10, and NO2 sensors that detects nitrogen dioxide from vehicle emissions, a multi-sensor array that tracks volatile organic compounds, temperature, and humidity. And last, it has an accelerometer that built-in step counter to correlate activity levels with exposure and symptoms. Of course, we can easily add sensors, for example, SO2, O3, or CO2 carbon dioxide. Our device is not just a product, it is a platform for comprehensive environmental health monitoring. The mobile app is Anna's command center for respiratory health. Through the app, she can view real-time environmental data from the wearable, see the personalized daily risk analysis, log planned activities and receive smart recommendation, track symptoms over time, receive alerts when conditions change, and access the complete health history for sharing with doctors. The interface is designed for simplicity and clarity. Even during stressful moments when breathing becomes difficult, Anna can quickly access the information she needs. The app telling Anna not just what the air quality is, but what she should do about it. Let me show you the questionnaire of mobile app. Okay, this is an Android emulator. We run now the mobile app. This is the first screen. Now we can, come on, okay. This is the questionnaire, and every patient can select from every question the answer from 1 to 5. Next, geographical area, for example, Thessaloniki. Again, Karilau is an area of Thessaloniki. And then finish. I will show you later the web interface. The questionnaire is submitted. Okay. Now, some words about this asthma questionnaire. We use an asthma questionnaire that's based on established medical protocols and validated assessment tools. The questionnaire helps us to establish baseline respiratory health for each patient, track symptoms and exposure over time, identify personal triggers and risk factors, and improve the accuracy of our predictive algorithm. The data from these questionnaires fits into our AI system, making it smarter and more personalized with every use. We are not just creating a consumer gadget. We are building a clinically validated tool that healthcare providers can trust and patients can rely on. Let me show you some exciting results from our first pilot study, which validates that AsthmaFit works in the real world. The pilot study had 15 subjects monitored over 2 weeks, total of 30 person weeks of data collected. The pilot was just observational study to test feasibility, and of course, it was self-funded. At the end of the pilot study, we observed a clear measurable relationship between PM2.5 levels and asthma symptoms. And when participants were exposed to thin particulate matter, their asthma control test scores declined, indicating worsening symptom control. This confirms what we suspected. Every short-term exposure to air pollution directly impacts respiratory health. Also, exposure to volatile organic compounds showed a strong correlation with symptom worsening. Last but not least, striking differences in individual sensitivities were observed among subjects. What triggers a severe reaction in one person might have minimal impact on another. This proves that each patient needs personalized risk assessment based on their unique triggers. This is exactly what AsthmaFit AI algorithm provides. We also learned from the pilot study some important lessons. For example, participants wore the device only 8% of daytime on average. The signal-to-noise ratio was low due to limited wear time, and the device weight and format need further reduction. Based on the lessons from Pilot 1, we want to execute a much larger validation study. This pilot will be in Thessaloniki, in Greece. This pilot will be interventional, not just observational like the pilot study 1. The sample size will be 50 participants with moderate asthma, and the duration will be 6 weeks per participant. This study will generate a complete data set for back validation for our AI algorithm, pre-train our AI on real-world data before commercial launch, and to successfully complete Pilot 2, further develop AsthmaFit and prepare for market launch, we are seeking approximately a funding of 250,000 euros. This investment will enable us to complete with rigorous data collection, finalize AI algorithm training and validation. Of course, following successful completion of Pilot 2, we will move to full clinical validation with an additional seed fund. This will provide evidence needed for regulatory approvals in Europe and beyond, partnerships with healthcare providers and insurance companies, and commercialization and scaling. Let me be clear about the opportunity we are pursuing. AsthmaFit represents a blue ocean opportunity. We are creating a new category of personalized respiratory health management. There is nothing else like AsthmaFit on the market today. Because traditional inhalers are reactive, not preventive. Air quality apps don't integrate personal health data. Smartwatches provide general health tracking, but not respiratory-specific environmental monitoring. And peak flow meters only measure lung function, not environmental triggers. We are the first and only solutions that combine real-time personal environment and individual symptom and exposure tracking. AsthmaFit enables safe and active living with asthma, giving millions of people their freedom back. AsthmaFit by RespiFit is transforming respiratory health management from reactive to proactive, from generic to personalized, and from uncertainty to confidence. Join us in giving millions of people like Anna the freedom to live actively and confidently with asthma. Thank you. Now I'm happy to answer your question, but before that, let me show you the web interface with data of patients. For example, if I go to myself, this is February 10, this is today, and this is the questionnaire that I have answered before. Okay, all these questions, Harilau, Thessaloniki, if you remember, is here. We can export PDF, export Excel, or edit questionnaire if I want. And let me, just a moment. Of course, you can have all the patients with their data. And let me show you a web interface for the doctors. This is a doctor interface. Who handle this web interface? A doctor. Of course, here, when the wearable is operating, all the data from wearable are transferred here every 10 or 5 minutes. We can go, for example, give me a second. Okay, for example, this is January 2025. This is some data from our pilot 1. And you can see the measurement, the data of the sensors. Okay. Let me show you the data and the timestamp for every patient. This was from pilot study 1. As I said before, now we are prepared for the pilot study 2. Thank you very much. Me and Alec are at your disposal for any further question or details.
Thanks, Christodoulos. I very much like that you mentioned funding. And what I had in mind, I will now share very briefly my screen with all of you. The idea of Shift Hub that has been completed officially by end of last December was to provide a vehicle so that startups like all three of you today, but also research groups from universities or other research centers might walk some extra further miles towards fundraising, building products, commercializing them. And the thing is that, and I have again no problem to mention this and publicly, this was not something that attracted interest. So while on the one side all entities are eager for fundraising, from the demo days there have been very few communications related to fundraising, and very few of these communications that took place ended up in some collaboration for proposals. By the way, I see also a comment from Veronica. Veronica, if you like, you can share also the web link, because now you mentioned only funding opportunities at eucols.net, but if you have some other information or your email so that people can share with you, feel free. So the idea is that we would like to have this type of networking, and it doesn't need to be central planned. It can be spontaneous and individual. So what I would show here is Paul Stefanat from Booster Labs has provided me some in an Excel file, all the relevant calls from health, industry, and food and bioeconomy that might be more related to actors from the health area. And one of the calls that I think might be very relevant to you, Christodoulos, is this public procurement of innovative solutions for improving citizens' access to healthcare through integrated or personalized approaches. And the context is that in a setting like the one we have here, there are companies, consultancy companies like Steinbeis and like Joist, where Veronica comes from. And there are also academic entities like University of Cologne or other partners that are other participants in today's event that you can find from the platform who has attended and who has been registered. So what I mean is that actually the ingredients for a potentially successful proposal in the public procurement are already here. And what is missing is only the will or the goodwill to spend some time in a very focused way so that there is no waste of time. I'm sure that we all are afraid of entering discussions that will lead nowhere. And then we prefer to not start a discussion than starting a discussion that will lead nowhere. But in many cases, you start a discussion with some people, and then if they are not willing or not able to carry on, then you can find someone else. So it's something that I think it's not part of the demo days from the organization point, but the aim is that we will have people who present their technologies and their solutions, that they get more engaged actively in the fundraising process. And you mentioned also an amount. Which was the amount that you mentioned there, Christodoulos? It was an amount.
250.
This is the other thing there, that at some point, so for instance, this is funding that is given, of course, to the entire consortium, and this should be between 3 and 8 million euros. And sometimes the tragedy is that you might need only 250,000 euros, but in order to get access to them, you have to plan something much bigger that will also offer financial means to several other entities like facilitators, mediators, consultants, academic settings that might design the uptake process, so that you may get at the end the amount that you had in mind plus some amount to properly run the project. But this is also part of what ShiftHub Legacy is about, to help interested entities in fundraising. So this is something that we would be also very happy to receive requests and messages from you. So then, thank you also, Veronica, for sharing your email. And now we go to the last presentation, and it's Elder, and
hello,
it's
everyone.
Elder from Portugal. And Elder has his own startup, which is the HC Healthcare and Innovation Portugal. And you will present a solution for health data visualization to support clinical and operational decision-making based on real-world data. So the floor is yours, Elder.
Thank you very much for all. As Adamantius said, I'm Elder Palheira. I'm a nurse from my background, and recently finished my master in medical informatics. I worked in a central hospital in Oporto, Portugal, during 16 years in the ICU unit, and have some some points that we do home care, clinical care at home. So I decided in some point of my career to develop something to join the points between the electronic health records from the hospital to the home care, because we find that we don't have any support when we are from this side in Portugal, by the way. We don't have any support of information from our patients. So I start, this is actually my second initiative in entrepreneurship, and I start the HC Healthcare Innovation to develop some software to join the points that I miss at home to do the best practice clinic at home. I'll start to giving a little presentation about my startup. We are already in the market as we are developing our infrastructure and our software. Our main point is to integrate AI in big data to support clinical decision and to organize the data visualization to the healthcare practitioners. But at the beginning, we found that it's particularly interesting, the home care environment, because our hospitals are getting burdened with a lot of treatments people, and they are stressing to take care of all patients. So we have as many technology as we have ever before. So how we can transport the technology to home. And we have to transport the technology and the human resources, like the nurses, the medical doctors, physical therapists, all the clinical practitioners. We have to match with our clients that are at home and provide them for the patients and for the providers the real and interesting information. We are reducing the strain of overburdened healthcare systems, removing barriers of travel and waiting times, and we are empowering patients, giving them access to organized clinical records. We are trying to align to European Health Data Space philosophy, don't expecting that the silos of that data will be worked and be less than that we have actually at the moment. Yeah, it's a little overview of the population in Portugal. It's kind of approximately to all Europe. We have very elderly populations, and they are increasing, and we don't have facilities that could get all the necessities that the elderly takes over. This is our first MVP that it's already on the market. And we work with this platform starts to, and I will in a few minutes demonstrate to you, that just arrange our human resources, medical doctors, nurses, and the necessities at this phase, our B2B partners, as they want some some professional to do a blood collection or a wound treatment. they can find in our application, and then we have the information from the patient to our healthcare provider. This is developed in PWA. It's a progressive web application that even the customer or anyone with any operating system at his phone could have the application, and we are UI and UX still have to improve. We know about it, but our focus now is to develop models that can attach in our electronic health records from our applications. We are extracting data from real world, from telemonitorization, from clinical records, blood samples, even scales or invoices to the insurance companies to predict the flow of the necessity of human resources, to prevent evaluation or degradation of wounds or any other state of health of our patients. I will try to do all the pathway of our application, and I will now share other screen. And let me do a little disclaimer. We here in Portugal, we are living severe conditions, and we have floods and heavy rain, and our server one of our server is on the center of Portugal, where have a lot of damage. So we are running our environment in secondary servers. So it's a disclaimer that's something we have more development than that, but I couldn't show you live, but I have some screenshots from other dashboards. So I'll start to show the workflow. Using the web browser, it works. I tried to put the web browser like a screen phone dimensions. So I will try to first we'll show the healthcare providers layout, and I will try to give you the example how they could put their availability to our platform. Let me just, have to do. So here, the professional healthcare provider could set his availability and is prepared to scale from every geographic region that we are. So imagine we have to get an availability for Friday, and it's just one day to set the availability. I can set the period of the day that I'm available to work, and then I can search the map where I want to be notified about the requests that our providers or customers or clients do. So in this case, I will be just notified in this region in Porto. I can set the parameter or the radius of my intervention. So if someone in this example, Slorico, ask for something, I won't be notified to admit this assignment. This works too, not just for Portugal, but it's ready for other countries. We actually use an API from Google that does the tracking, and then also adjust the routing for our providers. So this is an example how I set my availabilities. I already do it's mock data because I won't share real data. But in this case, I set up a client for tomorrow. I'll already assigned that. I have already received a notification and confirmed that I'm available to do that service. And as I open the service, I can see where it is, integrate with Google Maps or Waze to set up the routing for there. And then I have the other information about costing and in the personal and electronic health records and data visualization. I think I can jump for example, data visualization. I'll start with our management and just getting it. I will get with our management visualization. This is one partner. Actually, we are working with start to our position is B2B. We are working with other clinicians or other clinics, hospitals, and laboratories. And that's an example of this is real data, by the way. And this is an example of one of our partners. So I can see very fast and insightful the information about the last year calendar, the human research that that partner asked me to be able to do the service. The dark ones are more requests than one either. In this Tuesday, 26th of August, they asked me for 7 providers to work in their clinics. I could analyze the cost and the revenue and even the hours that each place asked me. Is I can see here how the consumption of hours each place asked for providers, and here our top nurses that did the service. We have also activity of human resources, like we are working in a way that any professional could assign to our platform. We have a considerable risk to they leave the platform as they don't have any service that goes to their geographic area. We can monitor that too. We can see that we have 26 nurses that works in this partner that probably went off the application because they don't have any service more than 90 days. There are 9 that are very active and they are all with service recently. And if I want to go in detail, I can see monitor the 14 professionals that have risk. Some by decreasing her activity, others because they don't have the scales or shifts in the last 3 months, or they have reduced their activity in 30%. We already have a dashboard that resumes clinical and health information. Here we monitor our number of patients. We have 255 patients monitored, and we can walk with different type of facilities. We have 230 that are in elderly homes, or nursing homes, and we have 25 that are in home care. And we can analyze how our our professionals are getting done the questionnaires of the electronic health records. We have 89% of completeness healthcare registers. We can see that we have our dependency and the level of independence of the patients. We have these ones are the full independence, and these ones are dependent in a low rate, and these are the moderate and the heavy dependence. We can trace the risk of fall and actually fall. These patients all have the risk of fall. 47 of them have high risks, medium high, and the medium high fall 7 times, and the high falls 5. We can expect that we need to provide more information to our healthcare practitioners and for the patients to prevent the fall. We can view an overview from our pressure ulcers, and we have other dashboards too that monitor the type of wound that we have, the dimensions of wounds, and the evaluation of the wound by the product that we are using on it. So it's a kind of that visualization that we want to give to our providers, to our healthcare providers, so they in a few minutes have a lot of information that could be able to decision making to our patients, and to be personalized and efficient, more than looking at the big data and unstructured sometimes, and difficult to catch all the information. We are now trying to find a clinical environment to do a pilot of extracting, to transform and load this information to data visualization, and working in real world data to produce evidence. We have already defined some pipelines to work on it. Actually, it was my my dissertation thesis, and we are getting in done in the wound care. We have trying to set up the things to work in an environmental in a hospital, in a central hospital in Porto, and in a clinic in the home care environment. So this is our performance as go to market. We already are scaling in 4 districts here in Portugal with our partners. We expect to, in the next year, we go to the consumer, the consumer, to the final consumer, and opens the B2C market. We are now developing these models according to standards and interoperability features to break the silos and share the clinical information. And as we have more information, we will get more insightful dashboards to decision making. So I think I don't have any further thing to demonstrate. I'm really sorry about the don't have the server online with these fully interactive dashboards, because I have other ones, but I didn't. I can't. I wasn't able to replicate in the secondary servers.
Don't
So
worry, Elder, because I was today in the morning I was trying to get some information from a dashboard of the commission, and it was also down. And I'm sure there that the people who are maintaining and operating the commission portal there are getting lots of millions to provide. Full operation, and it was not the case in the morning today. Many thanks, and I see also I could make the same comment as I made before to Christodoulos for fundraising, that there are also many future calls of Horizon Europe that might be very relevant to you. Of course, what I see is that from your side as an SME, as a startup, you have you face the difficulty to enter the market in terms that I'm sure that a big research institute like Fraunhofer Institute in Germany might have a much more privileged way to access consortia than you. But this is no excuse for not trying, or not trying to even more than other players who might be like expecting that government or ministry funding will provide them with enough resources. So let's stay in touch. Gabriele will take care so that all presentations and the video of the event will be in the portal, in the platform. And please feel very comfortable to contact us individually or through the central node of the platform. But the idea for me is that I'm very happy that there were certain things that were demonstrated, and people see that there are technologies, there are solutions that can be used. And not only, I see another opportunity because I saw the members of the event, the list of attendants, and many of us come from widening countries. There are also very relevant and very generous financing opportunities. So it's up to us to find ways to work together. And in many cases, I know that people are happy when they succeed in getting a project, and then they feel like that for the next 2 or 3 years, they have the luxury of not communicating, and they might start again communicating when the project is about to end or when the project is over. But this is not the right mindset. So the right mindset is to continue finding people that can be useful for walking the next miles of your either entrepreneurial or research activities. So meeting people and trying to build bridges is very important. Many thanks. Leonie, you will have the final word today. So the floor is yours. Say anything you like.
Yes, thank you very much. And also from our demonstrators, it was very interesting to see all your solutions. And also, even though some of the demos were not able to see in complete demonstration, I think we all got the point and the importance of the solution, and it was very interesting. Hopefully not only for me and also for the participants. And yeah, thank you again for the demonstrators and the presenters of the innovations. It was very inspiring, and also thank you to everyone who joined us for today's ShiftHub Demo Day. And I really enjoyed how the discussion went beyond only demonstrating things. So really finding the synergies, discuss opportunities for further funding, for example, for further clinical trials or pilotings. So this was very interesting, and also the key aspects of those demonstrations. So I think it was a very good example to see how these events like today's are vital for strengthening the innovation ecosystem in Europe. and also to bring together all our expertise here. As Adamantios already said, we have all the important stakeholders within this event, within the participants list. So it was very, very interesting. And yeah, I hope it helped us all not only to understand the solutions better, but also to see how we can really make use of such a community we have built in ShiftHub, and how we can further collaborate with each other. And I think this is really a very important aspect here. And yeah, other than that, I, of course, encourage you to stay connected within the ShiftHub ecosystem, to explore collaboration opportunities. As said, I think this is really the main aspect of such a living community, that we are staying interactive with each other, that communication is not, stepping out, that we are really stay active and reaching out to people. And on behalf of the entire ShiftHub team and our partners at the University Hospital Cologne, thank you once again for being us here today, and also for our speakers and presenters for really demonstrating your innovations. It was really a pleasure to hear those. And I see that Helder still has a
Yes,
hand raised, so please.
Just to give a note in the and thank you for your words, but as you say, in counter of this philosophy, if someone needs help to do ATLs from data visualization related in healthcare, if they want help, I could give some insights, and I wish I could explain something that can unblock something that are occurring. So if they are needed, I can they can reach out, and I have a quick word with them in this spirit of collaboration.
Perfect. Thank you. Yeah, and I think that applies for all of the demonstrators. So if you're interested in the specific demonstrations, feel free to reach out. And also, I'm not sure if you already have used the marketplace, not only for you as speakers, but also the participants. If you have any kind of solution, feel free to really showcase it in the marketplace within the community, to really get more visibility there, and also to highlight your own solution and get further promotion on that. Great.
Thank you very much.
Many thanks.
Thank you
Bye bye
all.
to all. Bye bye. Bye bye. Bye bye.
Enjoy the
Bye,
rest of your
everyone.
day. Bye bye.
Bye.
Bye.